Hi guys, I am Fatima Imanggubat, a second year student from section A4, and for today I will be demonstrating on how to insert a Foley catheter to a female patient. But before that, let me tell you about catheterization or Foley catheter. What is a catheter? A urinary catheter is a soft, hollow tube which is passed into the bladder to drain urine. Catheters are sometimes necessary for people who, for a variety of reasons, cannot empty their bladder in the usual way, like passing urine into a toilet or urinal. Purposes of urinary catheterization: relieve urinary retention, obtain a sterile urine specimen from a female patient, measure residual urine, empty the bladder before, during, or after surgery, and lastly, allows accurate measurement of urine output. So before we insert the Foley catheter to the patient, we need to do proper hand washing first. Then provide the patient's privacy by drawing the curtains or closing the door. The next is to put on our sterile gloves. Next is to verify the patient's name and date of birth by asking her. Then, explain the procedure to be done to the patient for her to lessen her anxiety. So in the actual setting, we need to let our patient bend their knees and open their hips. The next is to put the first drape underneath the genital. The second drape on the genital. Next is to clean or wipe the genital with cotton balls with betadine. Using the non-dominant hand to spread the labia. Wipe first from the farthest from you, towards you, lastly in the middle, then discard. We are now going to insert the Foley catheter through the urethral opening of the patient. While inserting the Foley catheter through the patient's urethral opening, we also need to let her take deep breaths to lessen the pain. Go ahead and insert until you see a urine return. Once you see urine return, you are all set and done with insertion. Now it's our time to inflate the balloon inside. Then afterwards, give it a tug to know if it has resistance or it does not comes out. And now we are going to put the tubing on the patient's leg and not under the patient's leg. And the drainage bag below the hips and must be put in an immovable area. Then we will now discard the drapes and sterile gloves used. After inserting the Foley catheter to the patient, we need to assist her back to its comfortable position. Then lastly, document the catheterization procedure to the patient's chart, which includes date and time, catheter size, characteristics, amount of urine, and lastly, the patient's reaction.